Check out what glaucoma is, its causes, and some lesser-known symptoms. Glaucoma is one of the leading causes of blindness worldwide. If we talk about irreversible blindness, it's the main cause. The other one is cataracts, which can be treated with surgery, as everyone knows, and it can restore vision in someone with cataracts. So what's the deal with glaucoma? The main cause of glaucoma is an increase in intraocular pressure, but it's actually a disease of the optic nerve. People start losing optic nerve fibers and their vision starts to decline, particularly their field of vision, which starts to get narrower. Why is it such a scary and serious disease? Because it usually doesn't give any symptoms. When someone loses a bit of their field of vision, they compensate by moving their head or their eye, so it doesn't affect their day-to-day life. That's why eye doctors say it's like a silent time bomb. You don't even know it's happening. Then all of a sudden the optic nerve fibers are already severely damaged, and there's no turning back. That's the big problem with glaucoma. If you catch it early, and like I said, one of the main causes, the increase in intraocular pressure, you can use eye drops to control it and go on with your life. Of course, most of the time, it won't reverse the damage that's already been done, because the optic nerve, which is made up of neurons, like I've mentioned before, doesn't regenerate that well. So the chance of fully recovering your vision is almost zero. But if you follow the guidelines correctly, like I tell my patients, you likely won't have any issues. Or if you do, you'll catch it early and avoid any serious consequences. Starting at age 40, an eye doctor will check your intraocular pressure. So if the main cause is high pressure, they'll find it during the exam. Since you might not have any symptoms, age 40 is usually the recommended starting point. You should visit the eye doctor every year, but after age 40, it's especially important. People of African descent have a higher incidence of glaucoma. Also, family history is one of the most common factors. So if a relative has glaucoma, your chances go up. Like my grandpa had glaucoma, so my chances are higher. So you'll need to consider all these factors. If you have symptoms, go see your eye doctor. But remember, this is a stealthy condition, and its prevalence is high for all these reasons I mentioned. And if you think about how it's the main cause of irreversible blindness, why wouldn't you just go to the eye doctor once a year? If you have it, they'll catch it early, prescribe treatment, and you'll avoid more serious complications. I hope this helps. There are a lot of different types of glaucoma and all that. But since I'm not an eye doctor, I'm a neurosurgeon, I deal with this kind of stuff all the time by giving advice to my patients. Many of them haven't seen an eye doctor in years because they didn't know any better. And when I refer them, they come back saying, "Oh, Julie,